Hi, I'm attorney Rachel Cheek, and today I want to talk about a question that I get a lot, which is how to get a protected rating. This concept is kind of broad. A protected rating, I think a lot of times when you hear that, when I heard it the first time at least, protected rating sounds like it's protected, VA can't take it away. And that's true in some regards, but it's not true for every single rating. Really, the only way to get a protected rating is to have a continued rating for a certain amount of time, meaning your rating stays the same over a period of certain years. That is going to be the case for a lot of disabilities that aren't expected to improve. So things like arthritis, unfortunately, a lot of times mental health conditions, neurological conditions, those tend to either progress or stay the same. They're not likely to improve. And those are what we call static disabilities. Again, static meaning not moving, still, stays at the same level. The advantage to having a static disability is that when a disability is considered static, not likely to change, that means that a veteran is no longer going to be subject to routine examinations. So I know that is something a lot of veterans are cautious about attending new C&P examinations. In the past, they used to be required every X amount of years for certain conditions. Now I see that a little bit less. I'm seeing more disabilities considered static without routine examinations required. But there are some conditions that do still require examinations at certain periods. So that's things like disabilities that are expected to improve. This can be something that you maybe go in to get temporary treatment for, such as you go in to get surgery on your knee, for example. Obviously, your knee is going to be pretty severe during the surgery and for a certain period after. But eventually, if the surgery works, you're going to expect to see improvement. For that reason, VA has temporary total disability ratings where they will grant 100% rating for a certain amount of time. And usually that's going to be things that require surgery. There'll be a certain amount of period of recovery that's mandated for that total rating or higher rating to continue. But then after a certain amount of time, VA is required to do another examination. And maybe even if the disability hasn't improved, the examination will reflect that and the rating could continue. But for certain conditions, they do have to do routine reexaminations. Another example there is going to be types of cancer. If you're fortunate enough where you have cancer, but it's a type that's able to be treated, and you go into remission or your symptoms completely lessen, the VA is required to rate all active cancers, no matter what type, at 100% while the cancer is active and while the patient is receiving treatment. So that can either be radiation treatment or chemotherapy. For whatever the amount of treatment course that's prescribed, you're going to be rated 100%. And you're going to be rated 100% until 6 months following your last treatment. If fortunately, the symptoms have remitted and you're found that the cancer is no longer active after 6 months, then the VA is going to reduce that 100% rating because the cancer is no longer active. And instead, you're going to be rated on the residuals of your cancer or treatment. So for example, prostate cancer is very common. Common with that is surgical treatment that is able to treat the prostate cancer and remove symptoms. However, a lot of times there are after effects such as erectile dysfunction or urinary problems. So a veteran, even if their prostate cancer is no longer active, they've received treatment, but they continue to have, say, urinary problems related to that cancer treatment, they will still be rated based on the urinary symptoms. What are we talking about when we talk about protected ratings? Again, it's going to be a certain period of years that's going to qualify you for what ratings are considered protected. So if a rating is in effect for less than 5 years and there is medical evidence by way of a C&P exam that shows that the condition is improved, VA can reduce the rating based on that single exam. They a lot of times shouldn't. Oftentimes there's medical evidence in other places than the exam that show that the condition hasn't improved. But technically they can try to reduce a rating just based on one exam if it's in effect for less than 5 years. So after 5 years, then we're looking at where the VA can no longer reduce a rating based solely on just one C&P exam. I know I have seen a lot of cases where veterans go to C&P exam. Based on that examination, the VA says, oh, well, your symptoms are much better. Like, we're actually going to go ahead and reduce you from 70% down to 30%. But then you turn out, speaking with the veteran and looking at their medical records, their conditions has not improved at all. And this was based completely maybe on a C&P exam that the examiner took 5 minutes to review the little form that they have and didn't truly ask questions of the veteran or listen or even really hear their case or treat them with respect, review their medical record. I could go on. In any case, the VA cannot use a single examination to reduce a rating unless there is other medical evidence that supports that the condition has improved. So again, protected rating is not like the VA can never take that rating away at 5 years. There's just a higher burden that they have to meet if they want to reduce that rating. 10 years, okay? Once you've had a rating and service connection that's been in effect for 10 years, the VA, unless they find fraud, or a clear and unmistakable error, they cannot sever that service connection. That happens sometimes where the VA says, by the way, we think we made a mistake and, you've been service connected for this condition for 8 years, but it's actually our bad. So how about if we take the service connection away? That happens sometimes, unfortunately. But after 10 years, VA can't propose that unless there's evidence of fraud, that you gain that service connection through misrepresenting the truth. And I almost never see that. I would say I never see that. However, at 10 years, the VA, while they can't take service connection away, they still can reduce the rating if the medical evidence shows that the rating should be reduced. So they can always still try to reduce you. Again, they cannot use a single C&P exam to do it. And they can't do it if the majority of the evidence suggests, that your rating that you have is correct and that it shouldn't be reduced. But the important thing at 10 years, they cannot sever service connection. Now, let's talk about the 20-year rule. This is more what people, I think, are thinking of when I hear them mention protected ratings. So truly protected ratings are ones that have been in effect for 20 years and you've stayed at the same rating. If it's been at the same rating for 20 years, so say you've got that 50% rating for depression and you've had that since August 11th, 2004. So it's been in effect for 20 years at this point. VA can never reduce below that 50% rating. They can raise it, but they cannot ever reduce it. Another example of that would be a veteran who has been rated 20% for cervical strain since 2003. That rating has been in effect 20% for over 20 years. The veteran can always ask for a higher rating if the condition has gotten worse, but the VA cannot reduce the rating no matter what. Again, unless fraud is shown that somehow that 20% rating was established through fraud. Something that also comes up when we talk about protected ratings would be permanent and total, the status of being permanently and totally disabled. So once you're found to be permanent and total, and you're going to be found that if you are granted IU, or if you are rated at 100% combined and you are receiving DEA benefits, that's disability educational assistance benefits. VA only grants those to veterans who are considered to be permanently and totally disabled. So that's like an easy way to know, like, am I P&T? that decision says that you've also been granted DEA benefits. Yes. So PNT, once a veteran's considered to be permanent in total, they're not going to be subject to reduction unless there's evidence that the medical condition has significantly improved. So again, this means that the VA is not going to have, they're not going to schedule routine reexaminations. You can always ask for a new exam if you're trying to get a different condition service connected, or your ratings bumped up for a certain condition to get special monthly compensation, something like that. C&P exams could still occur, but the VA is not going to just routinely schedule them once you're found to be permanent in total. Again, if there is extensive medical evidence that shows that the conditions that you're rated permanent in total for have improved, they technically could reduce you if the ratings have been in effect for less than 20 years, but they're usually not going to, just based on that permanent in total. Your disabilities are considered to be static and not subject to change.